This text discusses a sensitive topic for those undergoing hair transplantation, especially women correcting their hairlines, the phenomenon of post-hair transplant kinky hair, PTKH, or severely curly hair growing after surgery. I will provide a comprehensive explanation for the first time in history. Why do I say it's the first time? Because no one has known the cause of this issue, and I am the first to address it. As you can see, I published a paper in the Journal of Craniofacial Surgery, JCS, titled Post-Hair Transplantation Complication, Kinky or Severely Curly Hair. The term kinky in Korean doesn't have a direct translation, but it typically refers to the texture of African hair. Coily hair describes hair that is curled like coils, while kinky refers to tightly curled hair, which is often understood in Korean as bldg, or sometimes referred to as ramen hair. I will analyze and discuss the causes, prevention methods, and coping strategies for severely curly hair or kinky hair. Worldwide, no hair transplantation doctors have identified the cause or provided an explanation. Some hypotheses suggest that hair follicles may be slightly damaged during separation, causing the hair to bend, or that surrounding tissue may become scar tissue, pulling the hair in one direction and causing curls. However, none of these explanations are accurate. I have previously mentioned in my paper and YouTube videos that the issue arises from planting hair follicles too deeply. I will provide a complete explanation of why this occurs, how we at Dana are preparing for it, and how it can be prevented. This paper serves as the basis for my discussion. First, regarding kinky hair, as you can see in the photos, individuals who originally had straight or slightly wavy hair may experience completely curly kinky hair growth. You may have seen many cases online where this leads to difficulties in hairstyling and is considered unsightly. Many people come to me with concerns about this issue. This paper was published in the January 2024 issue of the Journal of Craniofacial Surgery, and it has received significant attention from numerous doctors worldwide who have contacted me for more information. In this paper, I categorized the severe curly hair and kinky hair into two types, PTKH and PTCH. KH stands for kinky hair and CH stands for curly hair. As I mentioned earlier, there isn't an appropriate Korean term for this, so I will refer to kinky hair as dwaejitail and curly hair as severely curly hair. Therefore, there has been little discussion or reporting on PTKH, post-hair transplant kinky hair, or PTCH, post-hair transplant curly hair, mentioned in this paper up to now. This phenomenon refers to the occurrence of kinky hair or severely curly hair after individuals with straight or wavy hair undergo hair transplantation and experience new hair growth. The only person who has presented a cause for this phenomenon is me, as I have already mentioned in my paper, that it is due to the Pax-tail-Destaveri curly transplant hair graft. So, that's what I said. It has been mentioned in the paper that the only cause is planting the hair follicles too deeply. PTKH, or kinky hair, is said to occur when hair follicles are planted too deeply below the skin surface during hair transplantation. This is the paper I submitted. In this paper, I mentioned that when planted too deeply, a digital curl occurs. Therefore, I have explained that the importance of depth control during hair follicle transplantation cannot be overstated. If hair follicles are transplanted too shallowly, they will fail to graft, and the hair follicles will die. If they are inserted too deeply, it causes unnecessary tissue damage due to the excessive depth, leading to increased scar tissue formation, blade wound healing, and impaired microcirculation recovery. Furthermore, this is highlighted in the section written in red. Transplanting too deeply can lead to severe pearls or indentation reactions. Therefore, I have stated in my paper that the depth at which the hair follicle is implanted should match the length of the hair follicle precisely. This is the 2017 edition of Hair Forum published, the Korean Society of Hair Restoration Surgery. In this article, I discussed the side effects of hair surgery, specifically mentioning postoperative care. It explains that the causes of post-traumatic curl, commonly referred to as digital curl, are excessive separation and damage during the hair follicle separation process, as well as damage to the hair bulb during the transplantation process. The author disagrees with this. This phenomenon mostly occurs when the hair follicles are implanted deeper in the skin level. Therefore, it is essential to make incisions that fit the hair follicles and to transplant at a depth that matches the skin level. Since 2017, I have documented these findings. In SCI papers, as mentioned, if the hair follicles are planted too deeply, it can lead to issues such as folliculitis, indentation reactions, bleeding, and reduced graft survival rates. There is nothing beneficial about planting at a deep depth. It is detrimental. I will illustrate this with a diagram. This shows the correct depth for transplantation. However, if the graft is placed too high, the hair follicles will fail to survive and will dry out and die. Conversely, if they are planted too deeply, it can immediately lead to folliculitis or digital curl. I have been discussing these phenomena at our hospital for many years. To prevent these issues, one of the key practices at our hospital is the use of wide-channel implanters, or wide-channel DNI. As stated in this paper, wide-channel implanters are used for every graft which are loaded with epidermis protein through the channel, automatically limiting the incision depth. So, this is what a wide-channel implanter looks like. If you look at the picture, you can see the DNI or the slit, and you will notice that there is an open channel between the needles. On the left is the narrow channel, and on the right is the wide channel. The narrow channel is obviously narrow, while the wide channel is wide. This is the DNI, taken from an article by Mauro Speranzini about DNI slits. It is also described here. The far left shows sharp needles, and the middle one is a dull needle. The channels are the same, but they are referred to as dull and widened needles. This channel is widened, but Mauro used to grind it by hand back then. However, I have developed various tools for DNI and hair planting. During this process, I had extensive discussions with Mauro. We collaborated on the size and shape of the channels, which led to the development of the DNI and a hair implantation needle. This is why we use a wide channel implanter. As Mauro mentioned in Figure 9, if the channel is too narrow, hair follicles cannot protrude outward properly, making it impossible to insert them correctly. You need to understand the differences in the shapes of incisional and non-incisional follicles. On the left is the incisional follicle, which is drop-shaped, while the triangular or cylindrical follicle is on the right. The non-incisional follicle is in the shape of an inverted triangle or mushroom. Since non-incisional follicles are pulled out, the bottom is thin and the top is cylindrical, whereas incisional follicles are trimmed after being extracted, resulting in a drop shape. This is why it appears this way. The inverted triangle-shaped non-incisional follicle, FOE, uses a wide channel for grafting, while the incisional follicle uses a narrow channel. Here, you can see that the follicle fits perfectly inside the cylinder, with only the hair protruding outside. The epidermis is also inserted in such a way that it protrudes outward. The reason for using non-incisional methods is that when you look at the width of the follicle taken using this method, you will see that it measures 0.863 millimeters in Koreans. If the channel is too narrow, the follicle gets damaged during insertion. Therefore, using a wide channel allows the follicle to be inserted in such a way that the epidermis protrudes outward. This epidermis, which is part of the non-incisional follicle, is grafted or inserted into the DNA structure. And when this protruding epidermis is grafted without trimming, it will appear round from the outside, resembling the frog eggs that many people often talk about. In the grafting scene, you can see these frog eggs. Many people find this very disgusting, but I want to emphasize that this frog egg appearance changes to a scab just a few hours after the surgery. It does not last for a month, 2 months, or even a week. It changes to a scab within a few hours or by the next morning, so there is no need to feel disgusted or scared. In fact, this scab, which resembles frog eggs, is the epidermis, and it helps regulate the spacing between follicles. During the surgery, the epidermis protrudes outward through the wide channel. However, understanding the structure of grafting or DNA is essential. When this protruding part punctures the skin, it gets caught. The needle is 7 millimeters, and combined with the base, the follicle is 5 millimeters, with the epidermis protruding about 2 millimeters. When it punctures, the epidermis gets caught, automatically controlling the depth. This means that the depth of the puncture is adjusted, and the epidermis remains protruding outside, which is why it looks like frog eggs. This also helps with depth control, and since it is shaped like a mushroom, it is similar to the letter T. We are using a grafting method. That makes it impossible to plant deeply, because it gets caught on the skin. However, as you can see here, the epidermis is sometimes trimmed sharply, in red. It's like cutting off both sides of a mushroom shape, but if you trim it like this, it doesn't get caught, right? The reason for this refinement is that it is not about inserting outside the channel, but rather trying to fit everything inside a cylindrical shape. To achieve this, it needs to be refined, but refining takes a long time, and there is a risk of drying or additional damage during the process. Additionally, because it protrudes outward, depth adjustment is not possible. Therefore, most doctors who use incisional grafting techniques often use narrow channel grafting devices. In contrast, we use wide channel grafting, or DNI, and we insert the epidermis without refining it, allowing for automatic depth control. This PTKH method fundamentally prevents digital curling. The details of what we have done are described in this paper. Furthermore, once the recognition process is complete, our hospital ensures that 100% of the doctors are aware. So after the surgery, 2 nurses use magnifying glasses to carefully adjust the height one last time. This means that they make slight adjustments, correcting any final discrepancies of about 0.1 millimeters to 0.2 millimeters. By adjusting the force, we control the depth of the insertion and attach the frog eggs, or epidermis, to the wide channel, allowing for precise desk control of the insertion depth. The shape of the epidermis resembles that of a mushroom, preventing it from going in too deep. During microscopic surgery, we organize the follicle level with a magnifying glass and perform meticulous surgery under magnification. This method has resulted in curly hair being almost non-existent in our hospital. Over the years, I have seen it almost never. It can be said to be less than 0.1%. The next part discussed in this paper is about PTKH and curly hair, which have rarely occurred in our hospital. It's an interesting topic. However, sometimes there is a slight curl that isn't actually curly hair. Despite all the efforts, including discussions with Morrow to create a wide channel and extracting the epidermis outward for implantation, while ensuring depth control and leveling, the cause remains unknown. Finding a path in darkness is always the hardest part. This information isn't found in any books, and no one knew that curly hair could result from deep implantation. I presented this, but despite that, I began to ponder and research the occasional weak curl that isn't quite curly hair for several years. As I delved deeper, I noticed that it occurs more frequently in women than in men, and more on the right side than the left. This is a fascinating phenomenon. So, why is that? Why does it rarely occur on the left side, and when it does, it's only slight? Why is it more common in women and more on the right side? The cause remains a mystery. No one has ever presented this, nor is it found in any books. So, one day, this content has also become part of the paper's description. A patient who underwent partial shaving in the occipital region came in about 6 months later. They had shaved the back in a box shape and performed a non-incisional punch surgery using clippers to trim it down to 1 millimeter. After about 6 months, their hair had grown approximately 6 to 7 centimeters. This individual has very thick hair, with a lot of volume, making it heavy. However, they mentioned that they have very slight wavy hair, but the area that was shaved is growing back curly. At that moment, I felt like I had been hit on the head with a hammer, realizing that this was not just about their hair, but a similar case. If you look closely, you might not see it in the video, but that area appears curly. In reality, it feels much more pronounced. In the photos, you will see that it is not extremely curly, but you can tell that the newly grown hair in the middle is indeed curly. Another point I mentioned is the difference between men and women. Why is there more curly hair in women? After seeing this individual, whose hair grew back curly only in the shaved area, I had a hypothesis. For decades, Doctors around the world have encountered this phenomenon during hair transplantation but did not know the cause. Now, as you listen to this explanation, I invite you to reason along with me. First, men's hair grows straight up, while women's hair grows lying down on the sides at an acute angle. Hair is growing. The angle and direction are different. Additionally, there are more cases on the sides or in the sideburn area. The hair is transplanted very flat, while for men, it is done standing up. If we consider the skin, men's hair grows this way, while women's hair grows this way. So, when men undergo surgery, we pull everything towards the doctor, whether it's a slits graft, a hair transplantation, or DNA. This method allows for a more comfortable transplantation. This is easier to control. However, in the case of women, since the hair grows sideways while lying down, it is transplanted this way. For right-handed individuals, the hair is laid down on the right side and moved parallel from right to left. Then, it punctures the skin. Imagine this, director. Which method do you think would be easier to control? It's not easy to control strength, is it? This means that controlling strength is easier for men. From an ergonomic perspective, this movement allows for finer strength control and manipulation. At PTKH, curly hair is rarely seen, but weak curl PTCH is more common in females and occurs more frequently on the right side. The reasons for this are: first, a difference in hair growth direction between males and females. Females grow at an acute angle while males grow at an obtuse angle, with females growing sideways and males growing more forward. The ergonomic adjustment of the angle during implantation is also different. Second, there is the DP, diverting point, which is the point where hair divides into left and right directions. Although the reason is unclear, it is mostly located on the left side of the female hairline. This means that on the left side, hair grows forward at an acute angle, while after passing the DP, it primarily grows sideways to the right. In this case, the DP is the point where hair divides left and right. For this individual, the DP is also on the left side. So hair on the left grows more forward while hair on the right grows more sideways. However, males grow more forward. Thus, females grow hair forward on the left and sideways on the right. The DP is mostly located on the left side. Now, you need to follow this thought process carefully. Since hair on the left grows this way, the existing hair does not block the newly growing hair. On the right side, the existing hair blocks the growth, effectively blocking the path. If the blocking hair is thick and voluminous, it becomes quite heavy. As a result, when hair grows, it does not add to the hair at the end, but pushes upward from below. Therefore, on the right side, the existing hair blocks the path, causing the hair to bend sideways like branches of a tree when it encounters a wall. This bending of hair is why there is more hair on the right side. Males grow straight, while females grow sideways, which is why it is particularly common in females. This can be explained as an imbalance between the speed of hair growth and the space needed for hair to grow. This is the same for deep implantation. Hair grows upward but must penetrate the skin. If it fits perfectly, it can simply grow into the air, but penetrating the skin is slower than growing into the air, causing more tangling inside. However, our hospital adjusts all levels for implantation, so curly hair does not develop. When the hair grows, it blocks the path. So by implanting slightly deeper, the hair grows less curly and more like a weak curl rather than curly hair. This is my theory, which has been accepted and published as a thesis. Supporting evidence for this includes comparisons of incision, non-incision, no shaving, and non-incision methods, which showed no differences in transplantation methods and frequency. Additionally, it was more common in individuals with thick and voluminous hair. If the hair is thin and weak, it can grow well, but if it is effectively blocked, it becomes obstructed. So, I drew this illustration. If normal hair grows like this, then PTKH looks like this, and PTCH looks like this. When straight-haired individuals receive a hair transplant, the transplanted hair can later become curly. This happens because the hair gets tangled due to the blocking phenomenon as it grows. Similarly, what does this mean? Since there is no space for growth, it becomes tangled inside. So, shouldn't this paper present how to manage and treat this issue? be considered a true clinical paper. In the case of PTCH, it should be left to grow longer rather than being cut like hair that is undergoing a magic perm or experiencing blocking. It can be annoying when it's curly, so people tend to cut it. However, when it tries to grow back, it gets blocked again, leading to more curliness. Therefore, instead of cutting it just because it's a bit inconvenient, it should either be left alone or treated with a magic perm to help it grow longer, which will naturally blend and reduce the curliness. Using hairbands or pins can help keep it styled until it grows out, effectively clearing the blocking. On the other hand, PTKH does not improve on its own. It should not be created from the start. Sometimes it can be permanent. Therefore, magic perms are done, and if there is no significant improvement, serious hair removal may be considered, followed by replanting. But this is not a common approach. Let's take a look at the differences through some photos. This person has the same appearance on both sides. Most curly hair tends to be symmetrical on both sides. This is PTKH. However, many patients, and even most doctors, often have difficulty distinguishing between PTKH and PDCH. Here we have PTKH, which is digitally curly, and this person's normal hair is straight, as seen in photo B. In photo A, you can see the stark contrast of the very curly white hair growing. In photo B, it is clearly visible. In photo E, we have a 34-year-old female patient whose hair is only curly on the right side. If you look at her, the left side has almost no curl, but on the left, the hair grows forward while on the right, it grows sideways. Therefore, there is no blocking phenomenon in the growth of the left hair. Only the right side experiences stagnation. If you look at this photo, it's very clear, right? The left side is growing forward, while the right side is growing sideways. So, on the left, there are no blocking hairs in the photo. However, on the right, since the length is blocked, PTCH occurs. Interestingly, if you look at photo B, which is from 4 months in, the transplanted hair is still not long, so there is no curliness. But when this person came back at 7 months, curliness had developed. PTKH is curly from the beginning. It makes complete sense, right? However, PTCH starts to become curly after growing for more than 4 months due to blocking of the existing hair. This person mentioned that they were fine at 4 months, but when they came in at 7 months, they started to notice curliness a month or 2 prior. This aligns perfectly with our theoretical understanding. In this case, you can see that the right side shows significant curliness, while the left side has almost none. It's the same phenomenon in image C. The growth direction of the hair is shown at the left side growing forward and the right side growing sideways. If you look closely, the left photo shows just waves with very little curl, while the right side is extremely curly. As you can see, in the case photo on the right, the hair is curly, while on the left, it is just growing straight. And you see the direction of the hair. The right side shows another case. On the right, there is PTCH. While on the left, you can see that it is just growing in waves or straight. I'm showing the back of the head, which demonstrates that the hair is straight. There is no curliness at all from the beginning. This photo shows it well, right? The right side is very curly, isn't it? On the left, there isn't much. There are little or almost none. In such cases, do not cut it. PTCH should be left to grow. Now, looking at the right side, you mentioned that the back is worse than the front. This person has complete blockage in the back, while the front has weaker blocking. So there is a little growth in the front and a lot in the back. There are also differences between the front and back for some individuals. This person has very thick hair and a lot of it, so the back is completely blocked and tangled, while the front has a slightly weaker blockage. Since there is no blockage on the left, it will definitely grow, making it an interesting case. All of these differences are visible. This is an interesting case. As you can see in the photo, I marked the area in red. That area contains the transplanted hair. If you closely examine the hair starting from the yellow line, you'll see that it grows out straight. As it grows out from the skin and approaches the existing hair, it starts to curl. Here, you can see the existing hair. And the newly growing hair starts out straight. It begins to curl as it meets the existing hair. However, it can't penetrate because there is too much of it, so it curls downwards and becomes wavy. This is a male patient. For men, the hair grows like this, and there isn't much of it. Now, if you look at the 4th month, it There is no curl at all at 4 months, right? It's been 6 months, and my hair is curly. Why? It blocks the growth, the existing hair. And if you look, there's a lot of it, right? It's thick, so it grows up like this. The back seems to be growing strangely. That's why it ends up being curly like this. There was none of this at 4 months. It hasn't reached that point yet. Compared to 5 or 6 months, it has become curly. So, you came in at 10 months, and it was indeed curly. This person finds it interesting to observe the direction of hair growth. For men, the hair grows in the center, and then extends outwards on both sides. Only the sides are curly. Why is that? Only the sides were blocked. So if you look at the direction of the hair, it ends here. Let's organize this. After the surgery, no one in the world knew the cause of curly hair. However, I have been saying for a long time that it is caused by deep planting. I have mentioned this in Korean forums, in papers, and in numerous lectures and academic presentations. I have talked about how deep planting causes this issue and that it should be avoided. Many times, that was the first time I addressed it, but I thought it would be resolved completely. Why? Our hospital performs surgeries in a way that fundamentally prevents deep planting by using a wide channel to control the depth, making it difficult for deep planting to occur. As a result, we have managed to minimize the occurrence of curly hair after surgery. However, there are still cases where the hair is slightly curly, though not to the extent of post-transplant kinky hair, bldg. This condition tends to improve over time and is more common in women than in men, and it occurs more frequently on the right side than the left. It is important to note that the mechanisms of occurrence, coping methods, and forms of these conditions are different. So it is not accurate to refer to all post-transplant curly hair as bldg. There is currently no specific term in Korean for this condition. Throughout my career, I have published numerous papers related to hair transplantation, and I have often encountered situations where there were no established terms for new surgical methods or theories. I have created many new terms, and this is another instance where a term does not exist in Korean. I am uncertain how this will be named in the future, but as more people discuss it, a name may emerge. For example, the term frog eggs was coined by the general public during a dark period. For now, I describe bldg as severe curly hair resulting from deep planting. LPTCH refers to milder curly hair. I have thought long and hard about how to categorize these conditions, but due to their different mechanisms of occurrence, I have chosen to express it this way. If you have watched this video in its entirety, I believe you have a sufficient understanding of the topic. In conclusion, it seems that our hospital has been able to prevent bldg or post-transplant kinky hair in over 99% of cases. Our hospital's surgical method is not perfect, as there will always be a few strands that may be missed, even if only a very small amount is produced. However, there are cases where bldg occurs due to the growth direction of existing hair. In such instances, it is advisable not to cut the hair, but to use a straightening treatment or let it grow long, as this often improves on its own. To expedite improvement, while it's unavoidable to style the hair when going out, at home, using a headband or similar accessory can help reduce pressure on the hair. Additionally, straightening the hair can assist in balancing the rate of hair growth and the space available for it. Understanding this balance will help you fully comprehend the digital curl that occurs after surgery. Based on my 20 years of experience in hair transplantation, treating thousands of patients, and discussions with many colleagues, I believe this theory best explains the curls that can occur after hair transplant surgery. If you are concerned, I believe you can find a good solution by coming to our hospital for a consultation and discussion. That's all.